Good afternoon. I'm Lauren Sonnenberg with LifeCore, and welcome to this week's edition of Mind Body Talk on chronic pain. And I've been wanting to talk about this topic for a good while, talking about Crohn's disease today and the overlooked cause of Crohn's disease. So if you're just joining in for the first time and this is your first Mind Body Talk, throw a little hello, let us know where you're watching from, and welcome. Thank you so much for joining in, even if you're catching this on the replay. So the overlooked cause of Crohn's disease. So we're talking about this underneath the umbrella of chronic pain because for those of you who don't have Crohn's disease or don't know anybody who's suffering from it and you just happen to end up watching this, there is a lot of pain involved with Crohn's disease along with other uncomfortable symptoms as well. And so you see it a lot as abdominal pain and cramping. So, of course, we want to find ways to reduce or, in the best case scenario, eliminate these symptoms, which means getting rid of the cycle that keeps people, getting rid of the problems that keep people stuck in the cycle. So what is the root cause? So I'm going to cut to the chase and then I'm going to explain why this is and how we know this to be true according to a certain science. So the root cause is a program that the body plays. Hi, Kathy, how are you? Thanks for joining. So the root cause is this program that the body gets into in response to a biological conflict called an indigestible morsel conflict. And what we see most frequently, the emotion that's associated with this conflict is anger. Now, as a psychotherapist, as well, I'm talking about these conflicts with people, I see the anger, but I also see other emotions layered in there as well. But anger shows up as the dominant emotion. But we all know underneath anger is fear, but there's an anger component involved. So maybe you've never heard of an indigestible morsel conflict. Probably 99.9% of you haven't. And so you're like, what are you talking about, Lauren? So, okay, that term is a German New Medicine term, which is a science that was figured out and discovered by Dr. Hammer, a doctor from Germany. And basically, what we see here, and we're just going to be focusing obviously on that part today. There's a lot more to the German New Medicine, but he found that the biological conflicts that we experience set in motion a series of events that help the body to adapt while you're conflict active with whatever conflict you're experiencing. And then there's a functional response that occurs as well in all of this. So everything that's happening, even though the symptoms are unpleasant oftentimes, there's actually a biological reason for this experience that a person has. Plus also, every time you have a part of the body involved with one of these conflicts, there's actually a relay location in the brain at a very predictable location based on what part of the body is involved that is involved. So it gets activated and you can actually see it on a brain scan. And depending upon whether we're active with the conflict or whether we're in a resolution or healing phase of the conflict, it will appear differently on the brain scan in a very predictable fashion. So, okay, so let's talk about this conflict. First of all, it involves the small intestine. And you have the small intestine is broken into three parts. You have the duodenum, the jejunum, and the ileum. And we're typically seeing issues impacting not so much the duodenum there, but the jejunum and the ileum. And the reason that is because those parts are most involved in the absorption of nutrients. And here we're talking about an indigestible morsel conflict. So imagine, let's start talking about an animal and then we'll talk about humans. So this can be an actual, literal, something that somebody's eaten that you can't break down, and biologically you need to be able to digest it, and it's stuck in the system. So you can imagine that a large animal eats a smaller animal, and for some reason there's a part of that animal that's stuck in there. I guess it happens in nature. It obviously does, because we've had this evolutionary type response. It's a functional response. But what happens, the same thing could happen for humans, but much more likely, much more often what happens is that we have something that's transposed into an emotional sense that we can't digest, which I suppose that's a leap for many people. But when somebody's really looking, when someone's open to like exploring, okay, why is my illness or disease not going away? Almost always a person can say, oh yeah, there's an emotional conflict. Maybe they don't understand where it's actually, why it's occurring, or you know, all the mechanisms of it, but most people will say, yeah, there's a definite emotional issue I can identify, like a marked one, not like, oh, maybe it fits, maybe it doesn't, but really a noticeable one. So maybe in some cases you have to do a little work to uncover it, but in many cases with something like Crohn's, people know what it is almost right away. But not to feel bad if you don't know what it is. If you're hearing this for the first time, you're like, I don't know what emotion, or I don't know what conflict it could be. It's very easy to determine, in fact. There are a lot of ways to figure it out, very simply, in fact. So this anger is related to a person, a situation, remarks that are made, especially like criticisms, insults, accusations, things that are hard to digest. We say it all the time. We say words like, wow, that was hard to digest. That was hard to take in. You know, we say it's not related to this part of the body, but more the upper digestive, you know, that's hard to swallow. You see, we talk about things in terms of mind, body, wording all the time. We're just not always aware that we are. But you can probably look back into your life and say, well, that was really hard to digest. That was hard to take. You know, that news was real difficult to handle. So now, that doesn't mean that every time a person says this, they're going to have a Crohn's experience. But these things happen all the time, and if the intensity isn't that high, it's just the body responds, it's under the radar screen, maybe you have like a little bout of diarrhea and you don't think much of it. But we start to think much of these things when they happen chronically, when they start to impact your functioning, when they start to get in the way of, well, you're driving in the car and you frequently have to stop the car to go to the bathroom, or you're at work and it's embarrassing to have to leave your desk a couple of times a day, or you feel like you have to wear a diaper, an adult diaper, to go to the grocery store, and you know, maybe you weren't planning on ever having to wear one. So, and those are just a couple of responses that people have to make when they're dealing with a chronic illness such as Crohn's disease. It's different for everybody, but there are some similarities across the board that people can likely relate to. So what's actually happening? All right, let's pull out our handy dandy little chart here. Okay, so we have our, we're going along, we're living our life, boom, 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 and here we have this conflict, this DHS, this conflict. So we get into this conflict active phase. What happens then when we're talking about this Crohn's experience? Crohn's hasn't shown up yet. We're having the conflict. The conflict just happened, just started. You're in the middle of this conflict, and what happens biologically? Cells start to proliferate. They start to grow in the intestine, okay? We're talking about the small intestine, as we mentioned before. And so how much will the cells grow? Well, it depends on how intense the conflict is. So this is where the function comes in here. The biological purpose of this cell growth is to help the intestine do its job of digesting the morsel. Talk about the body being innately programmed to take care of us. That is pretty amazing. Better able to absorb and digest, the morsel, which could be the literal morsel or the figurative morsel. I talked about the indigestible anger, for example. And what you see here, especially if the conflict goes on for some time, you'll see likely one of two types of growths. You'll see a flat growth or a cauliflower-like growth, depending upon the location. We're not going to get into all the little nitty-gritty there, but suffice to say that right now, okay? And this can be then seen through conventional medicine and diagnosed in certain cases as jejunal or ileal cancer. Cell growth, cancer. Cell minus, well, cell minus. The breaking down of those extra cells, which the body takes care of here when we go through the healing phase. So let's push on through this cycle and get into the next phase, assuming that you've had resolution to the conflict. Well, if you have Crohn's disease, you at least stepped into the resolution at least once. Well, you're there, you're in it, but there are a couple of things that make it prolonged or recurrent. So you've obviously gotten into the healing phase once your symptoms of Crohn's show up. Now, here's another part of German New Medicine that is it's really quite miraculous. The microbes, we often refer to them as germs, but there are things such as viruses and bacteria and mycobacteria and I'm missing one. It's escaping my mind right now. Fungi. Did I say fungi? That's coming up in a second. So we have those, and they actually play a role within the body, and actually your body is actually making them. I'll let you digest that for a second, to use a G&M term that's very fitting for today. Your body is making those microbes, and the body makes and utilizes those in proportion to how big the conflict is. So when you start to resolve this conflict, depending upon what's available, because remember, a lot of people have had certain shots, like let's say shots for TB and such, so that tubercular bacteria that could come in and break down those extra cells may not always be available, and it may also depend on the actual location in the intestinal tract in terms of what's being used, or it may be due to availability. I'm not exactly sure of which two in this case, but what we see in G&M is availability and what's there. Well, I guess that's all availability. So there's another thing that happens too, but we'll cross that bridge in another episode. So fungi, for example, when we have intestinal candidiasis, that candida is coming in to break down the extra cells that we no longer need. Okay, now remember, we're talking about here the healing phase, okay? It's hard to do. I always get reversed here. This healing phase, and this epicrisis is slightly exaggerated in my drawing, but we're in this healing phase here because we've started to resolve this conflict, okay? So we're in this healing phase. This is PCLA, and this is PCLB, post-conflictolysis, the first part and the second part. And then we have this epicrisis in the middle, or epileptoid crisis, okay? And TB can be involved as well in the breakdown of those extra cells that grew in the conflict active phase. And what happens there is they're breaking down the extra cells. When we see TB, we all often see night sweats for people, okay? And what other signs are we going to see for people? Diarrhea, mucus, bloody tarry stools could occur at this point. And this is the body getting rid of what it doesn't need anymore. The extra cells are being gotten rid of. The body is eliminating them because they served their purpose. They're not necessary anymore, so the body's getting rid of them. And it's not a pretty process, but it's an effective one. It's not a comfortable one, but it's an effective one. And it becomes, things like this become, at least from the emotional standpoint, it's easier to, there's more emotional comfort when you know what's going on. Even if it's physically uncomfortable, there's a sense of emotional, like, okay, my body's not backfiring, my body's not broken, my body's doing exactly what it needs to do to complete this phase, to complete this process. And that's a beautiful thing. And just the knowledge of that alone is enough to start to change the course of events for people, to empower people. And so if this conflict is reactivated, the next time you start to see, oh, look, oh, I know, I had that, look, here's my issue, and it got re-triggered, and now that it's resolved again, I'm having my symptoms again. Okay. Two symptoms I didn't talk about, just to make sure, of course, there's inflammation of the intestinal tract at this point when you have Crohn's, okay, during this healing phase. And what you will also see, if a particular part of the small intestine is involved, the jejunum, okay, then you're likely, if you have vomiting, it's likely that the jejunum is involved, okay, in this breakdown. Something else I wanted to make mention. Oh, yes. So the term ileocolitis, this is a common experience for Crohn's. This is the most common type of Crohn's, and you're going to see this affecting the final section of the small intestine. So the names can be, there are a lot of conventional medical terms. There's a lot of terms in G&M too. So it can be, people can get confused. What is it? This, is it that? So just take it all in stride, a little bit at a time. Don't get too worried about that. I give you that information so you can kind of tie the ends together. But don't worry about all the information. Just, you can watch the video. I'm not quite done with it, but I have a couple more things I want to share with you. But you can watch the video a number of times. You can take it in and slowly digest, seems to be the theme for today, slowly digest this information and see if you can really make sense of it. And then you can ask questions. You can put questions in the comments section. You could message me questions. You certainly can always call as well too. So now, what happens when this becomes chronic? So in a perfect world, we have our conflict, we have a resolution, and we skip along and go back to our normal life. Okay. But probably wouldn't have the term Crohn's disease if people just, boom, they had it once and off you went, and it didn't come back again. But it's recurrent. So why is it recurrent? So, well, I kind of already spoke to that a little bit. There are a couple of reasons. Well, why it be chronic? Chronic is slightly different than recurrent. Chronic is like, I never quite get through this healing phase. It may back off a little, but never fully. Or, basically what's happening is there are things interrupting that healing phase, okay? So if you get conflict active again, believe it or not, that's when the symptoms will back off a little, but then they come back because you're resolving the issue. Okay, now what about recurrent flare-ups where you go a period of time and you haven't had the symptoms. You think, oh, you might even think, oh, I might be in the free and clear here, da, 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 and then poof. Well, you can have certainly, if the conflict had gone away out of your life, it might have come back in. But what we often see are these things called tracts, and I've talked about them before. I actually talked about them in context of chronic migraines, but tracts can apply to many things when we're talking about German new medicine. So let's say the issue is anger with a spouse, okay? And let's just say it's pretty much ongoing, and at some point you're eating, pick any food that you might, if you have Crohn's, pick a food that you tend to have flare-ups due to. I'm not saying it's a definite here, but it's definitely worth looking at to see, do I have a food that's linked to that anger, to that indigestible morsel conflict, so that it becomes kind of my red alert system? Because when an anger conflict got initiated with, my spouse, the first time or the last time or any time in between, I happened to have been eating that food right then. We were at the dinner table and, had this blow up or something. I just had a confrontation, something like that. Now that food can become a track, which means that if you're going along, everything seems to be okay. You got into you're in the free and clear, got through your healing phase, and maybe you're not on this topic anymore, or you're not with that person anymore, or whatever it is. So there's no anger going on, and boom, you eat this food and you get the same response. And you say, well, Lauren, I watched your whole video, and, up until this point, I don't have any anger. I used to have anger in my life, and I don't have any anger in my life anymore. And if you still have these symptoms, and if it is Crohn's exactly, it's probably then likely due to a tract that gets you recurrently flared up. So you say, then what do we do to clear all this up? How do I deal with this anger issue and or these tracts? So, a couple of ways. Now, German new medicine will speak of primarily two ways. Practical resolutions, like, can you practically resolve that conflict in some way? Like, let's just say you've chronically had, headbutting with your boss, as an example. Well, maybe you can go get a different job. Maybe you can, maybe you can't. So that might be, this is a very simplified version of, okay, how could we practically resolve something? The other way is, there are a couple other ways, but in terms of G&M, another way is, just bringing this awareness of what's happening and shining light on it and saying, okay, I have this emotional or psychological awareness. I can see this happening. I can see my bodily response. So finding the awareness mixed with, okay, I can work through it on some level cognitively and overcome it. Great. As a psychotherapist, a lot of my work in, the first part of my career was more cognitive behavioral but then I learned some energy therapies, which to me, well, to a lot of people who use them, they know that it helps to bridge that gap, because a lot of times we're able to see situations differently. We can reframe them, look at them from a new light and a new angle. We can maybe even be compassionate towards that person we're having an anger conflict with. We might very well be, but a lot of times that emotional piece that is still triggered, it's just triggered. It's like, I can totally tone my anger down after it gets triggered in the first couple of seconds. I might not even say or do anything or show anything on the surface, but I'm still really taking it in. And where does it go? In this case, fitting this scenario, it's going to go right to the small intestine, because we have fight, flight, or freeze, which freeze is more like internalize. If I can't fight it and I can't run away from it, what am I going to do with it? I'm going to internalize it. I'm going to freeze it right into my body. That's how you'll digest it until you find a new way. So This is not a G&M approach. In fact, I don't know, it wasn't. EFT wasn't even around when G&M started. I'm thinking of the timeline. I think I am correct on that. I think it came like at least a decade later. It took a while to kind of make its way out, but it's well known right now. In fact, EFT is probably more well known than German New Medicine at this point on the whole. So what do we do with that then? Well, we use our tapping techniques. It's like acupressure desensitization, and there's a cognitive piece to it. There's cognitive shifts, there's an exposure therapy type piece to it. There are other things that are going on, reduction of cortisol levels. And so this whole very holistic approach to resolving conflicts. And ultimately, yeah, we may have the conflict happening like in our present day life, obviously, if you're dealing with the physical symptoms, but sometimes the seeds for these things are planted many, many years back, even into childhood, even before you ever saw symptoms. It's almost, I give the analogy of these emotions getting swept under the rug. People can have symptoms in childhood, of course, for many different illnesses, but sometimes these things don't show up until later on in life as the energy around it builds up. And so a conflict happens, straw that breaks the camel's back, and boom, now you see this is the first, you resolve it, and then you see this, these Crohn's symptoms. And so the reason I like to do energy therapy work such as EFT or matrix reimprinting, which I won't even get into the definition of right now, is because it's a very thorough process, and I don't think it's the best thing in the world just to provide a practical solution and nothing else, because we want to build up people's internal strengths to be able to handle what's coming their way. And yeah, cognitive shifts are great, and they're part of the process. They really are. But we also need a way to get the rest of the body on board, to get that all those emotions that are sunk into our body year after year, or even just once through a very intense conflict, to be able to be free of that, so we're not emotionally triggered all the time. And that's going to also, on one hand, take care of some pieces of the tracks. Now, the other great thing with EFT is, if it's done right, you're going to be able to identify those other tracks that are involved with your flare-ups with Crohn's. I can't get into, or I won't get into all the detail of how to do that here, because this is not an EFT training right now. And I think sometimes people are concerned that you'll miss the tracks, and sometimes they're hard to find, but they're so much easier to find with EFT when EFT is done properly and using a clinical approach and using thorough testing and so on and so forth. So I hope that if you are somebody who has Crohn's, that this has on some level inspired you to at least feel like there is hope, there's a way, there's something going on, that my body's not malfunctioning, that everything's happening here for a reason. My body's on my side. My body's trying to be adaptive and functional and responding accordingly to what's going on in my life. And to then say, okay, so what are your next steps then? Well, obviously you could call and do a wellness consultation. You do a free consultation and find out, Lauren, can you help me? That's an option. That might be a big step for some people. It might be a step some people are ready for. I do have a free chronic pain mind body empowerment group that you could share your story in and ask questions and learn more and understand this more. And so those are two really good places for you to start. There's more information on the web on the internet. You can learn more about this. And, I would also begin to share this information with your healthcare professionals that you feel comfortable sharing with. And the more that this information is spread out in the world and shared, the sooner it will become the go-to understanding, the understanding of medicine, because it's actually, it's provable on a brain scan. I won't get into why it hasn't gotten into the mainstream just yet, but that I should do a video on that real soon. In fact, maybe I'll do it. I'll do it soon, and or at least my thinking as to why it hasn't. I certainly don't know all the reasons per se, but there are a couple of pretty telling reasons. But anyway, I hope this helps you to feel like there's a next step, that there's something that can be done, that you could work with somebody who understands physical symptoms, somebody who understands German medicine, somebody who understands EFT, and can use those approaches and understandings and the science of all that together to help you become free of the cycle that you've been in, so that you can live more comfortably as you go forward. Thanks so much for watching. If this was helpful for you in any way, please give a little thumbs up or a hearts, or put a comment below. And also, if you have a related type of disease going on and you're looking forward to hearing a Mind Body Talk on chronic pain episode about that, definitely let me know. You can put it in the comments, you can send me a message, you can reach out and say, Lauren, email me and say, Lauren, will you do a topic on this? I'd be happy to. If you have singular questions and you want me to address them in Mind Body Talk episodes, I am more than happy to do so. My job, my passion, my vocation is to help people really understand mind-body medicine and to really feel empowered to go out there and heal what needs to be healed and understand why their body's doing what it's doing. So thanks again. I'll talk to you soon. Take care. Bye-bye.